Hi, I'm Dr. Mike Milligan. We're here at the Excellence in Dentistry Seminar in Florida. By the way, if you haven't been to the Excellence in Dentistry seminars by Woody Oaks, they're phenomenal. They're great information, they're great networking experiences. So really go ahead and come to some of the Excellence in Dentistry seminars. But I've got one of the speakers here, Dr. Joe Stephen. Joe, thanks so much for being with us.
Hi, Mike. My pleasure.
Joe's from Wichita, Kansas, and he does so many things, and he's been around for a long time in dentistry. He does seminars, he has Kisco, his company, articles, newsletters. And Joe, why don't you tell us a little bit about Kisco and all the things you've done in dentistry now?
Well, Mike, gosh, a little over 25 years ago we started Kisco. Okay. And people always ask, what does Kisco stand for?
Yeah, what does Kisco stand for,
Very
Joe?
good. It's the Keep It Simple Company, because our philosophy was just keep things simple. Too many doctors make things way too complicated. We started off with one little product. It was to combine all those office brochures into one little booklet. That was our first product, called the Dental Diary and Information Booklet. Right. And then we just grew from there. Now we have a catalog with, I don't know, a couple hundred products now. And then we got in the seminar business. My best friend, Dr. Mark Trello, we started doing the seminar years ago called the $1 Million Staff.
Right, and I've taken that seminar. It was excellent, by
good.
the way. You
good,
bet.
Thanks.
You bet. Brought the whole staff.
Good, all right.
Yeah. And now we're doing over $1 million. So
very good. All right, there we go.
Okay.
Because I think, you know this, Mike, our practices are very similar. It's all about the team. You've got to have an excellent team. Without a team, you know, I've met so many doctors who are extremely successful, but they may not have the best personality at all.
Right.
But they're smart enough to hire good people.
Right.
And the team makes them a success in spite of themselves. So it's all about the team.
Yeah. Certainly I'm that way.
Yeah, sure.
About the team for me.
Yeah. But no, that's important. And then we've gone on from there. Mark and I just recently started doing a new seminar called Team Dynamics, talking about the dynamics between the team itself and the dynamics between the team and the doctor, and then of course the team and the patients. So we cover a lot of different things. And then I do several seminars myself. For the last 10 years I've been doing a meeting called Efficient Dentistry that composes all the different assets, all the things we do in our practice, clinical, practice management. Right. And then I started doing a seminar called Efficient Endo, which I think there's a big need for that. Too many doctors are referring endo out. Yep. And in my seminars I say, you know, I know this sounds hard to believe, but when I'm doing molar endo, if it takes me more than 30 minutes, that's a very difficult case.
Wow.
And the doctor says, oh, come on. I spend 2 hours doing that. Well, if you're spending 2 hours doing molar endo, refer it out. Or better yet, learn how to do it in a very efficient way. You know.
Exactly.
And the system I'm using, the SafeSider system developed by Dr. Barry Musicant, these instruments don't break. Okay. So the cost is like 90% less for materials, and they don't break, so you don't have to worry about that.
So you've got this in a seminar that you present.
Yeah.
Now, how do we find out about your seminars and the other products that you have?
I'm glad you asked, Mike. You go to our website, www.kiscodental.com.
Kisco.
Kisco.com. And we've got all our information on there about all of our products and our seminars. And then the other seminar I do is Efficient Prosthetics.
Yeah.
Because a good friend of mine, my lab man, Kaler Dental, Dennis Kaler's father, did seminars 30 years ago about the 3-appointment duplicate or replacement denture.
Sure, yeah.
So Dennis contacts me a few years ago and he says, Joe, there's a big need for this course because a lot of doctors aren't doing dentures. And that kind of surprised me. Yeah. And so now we're going around the country doing seminars on this because doctors say, you're doing a new denture in 3 visits? He says, yeah. And it's an excellent system. Okay. So it's a hands-on program where the doctor and their assistants could sit in the room and see exactly how we're doing this. Mm-hmm. So it's all about efficiency. If you're not efficient,
you're kind of the blue-collar man's dentist.
That's right. That's right.
And the average dentist out there would relate more to you than several of the top speakers.
Well, that's true because I hear that quite often. One of the best compliments I get is when a doctor comes up at my meetings and they go, you know, Joe, I'm glad I'm here because it sounds like your practice is so similar to mine, but I'm not getting up there. Yeah. And I'm glad to hear this. See, a lot of people say, Joe, you're the voice of the silent majority.
Okay,
and
there you go.
Because the silent majority is that large group of dentists that you never hear about because it's not cool, it doesn't sound elite to sit there and say, you got to work out a lot of operatories, you got to have a large staff, and you got to run a lot of new patients through there. What everybody likes to hear is work on fewer patients per hour, charge a higher fee per procedure, require cash up front, and don't deal with insurance companies. Sounds good, doesn't it?
It sounds great.
Yeah.
But we live in the real world.
That's right. I mean, I go to these seminars and I listen to that and I go, yeah, that's what I want to do. And then I go, wait a minute. Reality hits me and I go, no, my patients, they're lucky to come up with $98 for an extraction, you know? So I practice in the real world. And that's why people call me the voice of the silent majority, because most people don't talk about that. The majority of dentists, though, are just like you and me that struggle to make a good living. But once you put the right formula together, you rise to the top.
It can be good.
Yeah,
absolutely.
It could be very good.
It can be a very wonderful service for the many people, and a wonderful income for you and your family.
Yeah,
absolutely.
And I find it, truthfully, less stressful than to sit there and spending tens of thousands of dollars in marketing and then whining and dining these patients and coercing them into these high treatment plans. I present treatment, but if they're not interested, that's fine. You know, we've got other alternatives.
So you've got a newsletter. Now, how many dentists do you send this out to? Probably everyone.
No. Well, we used to. We used to send it to every dentist around the country, but it was just too cost prohibitive. So now we send it to just 10,000 of our clients
10,000.
every month. And it's just an 8-page newsletter, and we've got great articles in there. And
now, can they sign up for that at Kisco.com?
Oh, sure. Yeah.
All right.
Just let us know. We'll get you on our mailing.
Newsletter, and you're always
and there's no
finding
charge.
new products.
Oh, yeah.
New products that he puts in there and techniques and things like that.
Yeah, we're always adding new products every month almost, it seems.
You bet.
But I've had a lot of fun with it, and a lot of doctors seem to appreciate it, and we do pretty well with it.
Absolutely. So, okay, Joe. Well, what else would you like to tell us? Don't talk about your golf game. We don't. You know, I know you won $25 yesterday.
That's right.
On the course
and
there.
You didn't go with us, and I think I would have beat you because I had my best game ever,
well,
which is not all that good, but I did shoot a 87.
Oh, fantastic!
And I know you're a scratch golfer, so.
But so, what would you like to leave us with here before we close?
Well, I really think doctors really need to understand, and this is one challenge that I have faced for the last 20 years doing seminars. It really is all about the staff and it's about efficiency. Two totally different categories, but you have to develop a great staff. I've got a consulting service. It's a monthly recording that I do, and I'm not trying to replace an in-house consultant, but in a way it kind of does replace that. I've never had a consultant come into my office. I just don't like them to meddle, you know, and a lot of doctors are that way. So I've had a lot of doctors say, do you have a consulting service? Can you come? No, I don't do that. But I came up with this program. It's a monthly program, qualifies you for 3 hours of CE credit every month. And also it allows you to a 20% discount off all of our products and any seminars you may attend. So we've had doctors for the last 3 or 4 years on this program. And basically I'm stepping them through what it takes to develop an excellent, profitable practice. And I start, number one, developing a winning team, because so many doctors just miss the key things on that.
That's huge.
You know, that's huge. And then, of course, in the program, I get into all kinds of clinical stuff. And because it's all about efficiency, once again, if you're taking a long time to do endo, it's not profitable. Crown and bridge, H&H cordless impression technique. I've been lecturing about that for 10 years. When I put my handpiece down, 2 minutes later, the final impression is done. That's efficiency. You do 4 units of crown and bridge, and typically a doctor will have the assistant or the doctor will pack retraction cord. Then you wait, you take it out. Oh, it's bleeding again. Let's stop the bleeding. Well, with the H&H, we don't stop the bleeding. We don't control a dry field. Bleeding gum, saliva, it doesn't matter. 2 minutes later, the impression is done. And the list goes on. Surgery, oh my gosh. Luxators, best thing I've ever used. Physics forceps, and the list goes on and on. So it's all about efficiency.
So if you really want to get in tune with the average dentist mentality and how to grow that practice, you know, for the most of us out here, get in touch with Joe Stephen, www.kisco.com. Joe, thanks so much for being with us today.
Thanks a lot, Mike.
All righty, great.